Muscle tightness and spasms can often follow injuries, and if left untreated, can lead to more serious problems. Here to tell us about a unique way of treating that muscle tightness is Dr. Jason Hazelet from Stepping Up Physical Therapy. Thanks for joining us, Jason.
Good to see you. Good to see you.
So, what are some of the other side effects that can happen with that muscle tightness and soreness and those spasms?
Right. Sometimes we have postures that maybe aren't the best posture for us for a while, and if we don't move out of those postures, the muscles tend to adaptively shorten, and they stay like that. And then after a while, you can't get into a correct posture. And so if those muscles are always pulling us down, and if our head's forward and this part closes in, it can lead to headaches, pain behind the eye, muscle tension up through here, and then you just can't get comfortable. Sitting at work, sitting at the computer, it's just hard to get comfortable.
Right, you're compensating for the pain, but then you're creating other problems doing that.
Right.
So then what is trigger point dry needling?
So it's the use of acupuncture needles, and I always get asked, is this acupuncture? And it's not. Acupuncture is based on traditional Chinese medicine. We do use the same needles, but we are going to target specific issues to help get trigger points or those knots, tender spots out of the muscles. It's called dry needling because there's no injection. We're not putting any type of medicine into the muscle. But the act of putting a metal needle into an active trigger point helps to discharge that trigger point, and then the muscle tissue relaxes after that.
So how often do you have to do this?
Well, once somebody's come in with a problem, usually we'll see them maybe twice a week. Say a chronic headache sufferer, someone who's had headaches for years and they've had all kinds of medications and so forth. We might have to see them 12, 18 visits, but usually probably 4 to 6 weeks of treatment, and it's not the fix-all. So dry needling doesn't fix it. I mean, it takes the pain away, it helps get you where you need to be, but you've got to fix the posture, you got to fix what's causing the problem. So physical therapy as a whole is what can help with that.
Right, it's just part of the overall solution.
Right.
But certainly if you're suffering from pain, that can be a really big deal to get that to go away.
Yeah.
And so with all of those other treatments, you could always need the dry needling, or is that something that you would phase out eventually?
We would phase out of that. You got to go into more functional type stuff, corrective postures and exercises. But for the people that come in with all this nagging pain that's back here between the shoulder blade, the headaches, it's a great treatment for that. Tennis elbow, lateral epicondylitis, it works great for that as well.
All right, a lot of folks you can help out. Thank you very much, Jason. And if you can find out more about Stepping Up Physical Therapy by calling the number on your screen or go to steppinguppt.com. Pat will send it back to you.